Good evening and welcome to our viewers, Globespan 24x7. On our Monday night program, we want to thank Noah Singh for bringing this platform and making it available to us, and of course to Devin Bisu, our technical specialist. Tonight, we are very privileged and honored to have with us the Honorable Minister of Health, Dr. Frank Anthony. Dr. Anthony, welcome to the program tonight.
Well, thank you very much for having me. It's my pleasure to be here with you.
Lovely. And Dr. Rose, my co-host, welcome to the program tonight.
Thank you, Charles. Thank you.
Minister, my first question to you, when you took office in August of last year, and you went to the Ministry of Health, give us a candid view of the state of affairs of the ministry that you took over.
When we came into office in August, there were plenty of things that we had to deal with. First of all, we had the pandemic that we had to deal with because, as you would recall, we were doing about 21 PCR tests per day, which was certainly not enough. And if you had to get a test, say, in Region 9 or Region 1 or Region 8 or Region 7, sometimes it took as much as 7 days before you can get the turnaround on that test. And so that was very challenging in terms of managing the pandemic. And of course, we did not have enough ventilators. We did not have enough beds in the regional hospitals and so forth. And so that was very challenging. So that's just one aspect. That's just dealing with COVID. And we also discovered that they did not have enough PPEs. So while we want to protect our frontline health workers, there wasn't enough PPEs for people. We had limited amount of N95 masks and gowns and so forth. And all of that presented a challenge to us in how we are going to manage COVID-19. In addition to that, there was chronic drug shortages across the system, because we discovered that since about 2017 or 2018, that medicines were not bought for the public sector. And therefore, many of the critical drugs that were needed across the different communities were not available. And so we had to then try to manage that crisis in terms of getting procurement going to buy medicines. And as if that was not bad enough, when we checked the bond, we had to throw away medicines that were worth close to $1 billion Guyana because they had expired. So on one hand, people who needed medicine weren't getting it because of whatever was going on with the distribution system. And at the bond, they had medicines that expired. So we had to dump them because you couldn't give that to anybody to use. So chronic drug shortages, and you had all these problems with equipment and x-rays not working and laboratory equipment not working and so forth. So it was a really mess, a big mess that we had to start working on to fix. And so, those initial days were really tough days.
Thank you, Minister. And we want to get into some details of that later on in the program tonight. But I want to ask you, in the last PEP government, you had a different portfolio. If the president had given you a choice between your previous ministry and the one that you're heading now, which one would you choose?
This is my background. This is what I know. I've been trained in public health, and also, my previous training is in medicine. So this is what I like doing. I spent actually 13 years in the Ministry of Health before going to the job at Culture, Youth and Sports. So I actually have a lot of experience in health, having served at different levels in the health ministry previously.
Without doubt. So your answer is the Ministry of Health. One question before Dr. Rose come on. The current budget earmarked $53 billion for your ministry. We will want to get into details of it, but what are some of the areas that you will concentrate those funds in should this budget be approved?
Well, I mean, how the budget is structured and how the ministry's budget is structured, we previously had 7 major areas under the current budget. And in this year, we have asked for an 8th area to be included. So the funds for the current budget is going to cover those areas. This includes the administration of the ministry. We're looking at clinical services that we offer across the board. We're looking at disease control, and we have separated out infectious disease from chronic non-communicable diseases. We do a lot of training in the ministry, so another portion of the budget goes to training. We have to manage a lot of technical services, so labs and so forth, so another set of money goes in that direction. We also work with people with disabilities, so we have a section that deals with disabilities. So in terms of our current budget, that's how the money is spread in these major sections. And we can go through the details if you like.
Yeah, we'll go through that along the program.
Yeah.
Thanks, Minister. Dr. Rose?
And on the capital side, we, of course, there are some major things that we wanted to do. And so that's also in the capital budget.
Okay. Dr. Rose?
Yes, Dr. Anthony, welcome to the program, and it's a pleasure having you here. Now, my question to you is simple and basic. You have inherited the COVID-19 pandemic from the last administration, the previous government.
Mm-hmm.
How do your Ministry of Health is coping with it? Do you have a qualified staff and all the equipment and machinery or whatever it is to deal with this deadly or dreadful disease?
Yes, we came in, we met all the deficiencies that were there in terms of the response, and we started to quickly turn that around. So the way that we are responding medically has to do with a couple of things that we focused on. The first one is to look at how do we protect our healthcare staff. And this is not just those in Georgetown, but across the system. And so one of the things that we set about doing is to ensure that we have adequate personal protection equipment, which would include the mask and the gowns and the hair caps and all of those things that are necessary. And so we have actually spent millions, if not billions of dollars procuring these things. And we have distributed it across the system so that every health worker is now protected. Right. In addition to that, we thought it was necessary that we increase testing. And so we have invested heavily in terms of getting the equipment to do testing. And as you can imagine, that was a challenge because everybody now are trying to get the same types of equipment, trying to get test kits and all of that. But there's a shortage on the market.
Okay.
Hard to be able to procure those things. As I said, when we started the program, when we came in, we found that the APNU was doing probably about 21 tests per day. We have increased that capacity. On average, we do maybe about 350 tests per day. These are the PCR tests. And we have built the capacity at our National Public Health Reference Lab to be able to do, if necessary, up to 2,000 tests per day. And that's a big difference. So in addition to that, PCR were only done by the National Public Health Reference Lab. And we have now started working with the private sector to ensure that they have the capability. So the Eureka Medical Laboratories, for example, have been certified by us. And we are aware that there are a number of other private entities that are now working to make sure that their equipment can be certified and they're able to do these tests. We have also worked at the regional level to build capacity to make sure that regional hospitals would be able to do point-of-care testing, meaning right at the regional hospital you can get a PCR test. Right. You don't have to send that sample to Georgetown. to get it done. And so we bought some special machine called Gene Expert machine, and we were able to do those point of care testing right in the region. So we started in Latin and in Region 1 at Mabaruma, and we are now working to put in 2 other machines in Region 7 and Region 8. We also have such a machine in Linden, and we have one in New Amsterdam. So you can do this point of care testing right on site, and you get back those results, say, within 30 minutes. So which is a quick turnaround. And it's very helping patients, or you want to make sure that you have the right diagnosis. And in addition to all of that, we have also introduced the antigen testing. And so we have trained literally a lot of our primary healthcare doctors to be able to do the antigen testing. And these tests, if you're symptomatic, we can normally get a positive results fairly quickly. It takes probably about 15 to 20 minutes to do such a test. So again, this is a big plus in helping to make the diagnosis and be able to treat the patients very quickly. So testing has improved quite significantly. And more recently, we have authorized about 6 private laboratories, including at the private hospitals, to be able to do antigen testing. And we are now working to certify some of these laboratories in the different regions. So people would have an option. If they want to come and get tested at a public health facility, that's fine. If they want to go at a private facility and do the test, that's also fine. But we want them to have access to it. And so testing was one of the major things that we worked on. And at this point, we have enough capacity to be able to do the types of tests that we need to do to identify COVID. And in addition to testing, we also wanted to build hospital capacity because, as you know, with COVID, about 80% of those who are diagnosed with COVID might be asymptomatic or mildly symptomatic, but 20% would require hospitalization. We did not have enough hospital beds for those 20% that would get sick. And so it was very important that we start building out that capacity to make sure that at every regional hospital, we had beds that were designated for COVID, that these patients would be properly isolated, and that they had ventilators, because as you would know, a lot of people require ventilatory support. And in all the regional hospitals, they did not have ventilators. So we had to buy ventilators, bring them in, train people how to use them, deploy those ventilators out into the region to make sure that there were adequate supplies of ventilators. And there's a big challenge in some of the hinterland areas because oxygen. If you have to take oxygen in cylinders up to those communities, it's a big challenge. So we bought a machine called an oxygen concentrator, where we are able to take normal air and you extract the oxygen out of normal air so that you're able to concentrate the oxygen and provide that as support for the patients who need it. So that was a good thing. And so now all our regional hospitals are properly equipped with ventilators. We have adequate beds to help patients, and of course, all the equipment. And then a subset of these patients would require ICU care. So on average, maybe about 4% of the patients who are infected with COVID would require ICU care. And so we have, as you know, when the APNU left, they left us a shell at Ocean View.
Right.
We now have 150 beds at Ocean View where patients can be isolated. And we have an ICU there of about 25 beds. Previously, the ICU beds were at the Georgetown Public Hospital, where we had about 15 beds or so. But because they were housing it at Georgetown Public Hospital, it disrupted the services of what was happening at GPHC. And therefore, they couldn't admit people for other causes. They couldn't do planned surgeries and all of that. So now that we have decanted all of this COVID activity to this specialized site, we are now able to return the Georgetown Public Hospital to a sense of normalcy where we are trying to clear up the surgical backlogs and so forth. So from a medical standpoint, we try to build the capacity to deal with patients who get sick and need hospital care. And then we start buying some of the medication that we felt was working, like remdesivir and so forth. And that was a novelty in Guyana because it wasn't available before. We bought remdesivir, we're using it on our patients. All the meds that are needed for these critically ill patients, we make sure that we had them in good supplies. And we started using convalescent plasma. So for patients who were previously sick, we start then taking their plasma and utilizing it for the patients who were critically ill. So, we did a lot of work in terms of how we manage our patients. And of course, we set up a group of the clinicians so that we can keep up to date with what was the latest treatment protocols that were being used in the US and Europe and so forth. And we try as much as possible to make sure that the same protocols are to our hospitals. Aside from all of that, we also recognize that we need to work with the people in order to get them properly educated about how COVID is transmitted. And so along with the joint services, we were able to launch Operation COVID Curb. And this was an operation where joint service personnel, along with ministerial health personnel, was going around community by community. We were sharing out leaflets, talking to people about the importance of wearing masks and keeping social distancing and so forth. And we had varying levels of success because we still have a lot of people who are non-compliant with some of those measures. But I guess we still have to persist talking to people and getting them to understand how this disease is being transmitted.
Okay, with that note, we'll let you come back to that. I want to switch up a little, talking about mental health issues.
Sure.
It's been a major problem now, not only in Guyana, but throughout the world.
Yeah.
As a medical director yourself, how do you intend to address this issue, especially in Guyana? Do you have enough mental health experts to deal with this type of disease?
Mental health is becoming more of a challenge. And one of the things that was set up was a mental health department in the ministry. But that department, we have to restructure it and we have to recruit more people because we need more trained psychologists and psychiatrists to be able to widen the set of services that we're offering. But apart from the specialized care that is needed, one of the things that we did over the last 4 months or so was that we devised a training program where we were talking to the primary healthcare physicians. So these are physicians who are at the health centers and health posts and so forth. And we recognize that many of the primary healthcare physicians did not have the skill set, so to speak, to be able to detect mental health issues. And so we developed a training program. We had about 80 of our physicians take part in this program. And we ran that training for about a month and a half, where we were able to update persons on some of the things, giving them tools and so forth to be able to diagnose some of the more popular or common mental health issues such as depression and so forth. But this is a program that we have to continue. And I think also in the long term, we have to integrate more of this type of training in our teaching programs, both in terms of nursing and in the way that we're training our doctors. We have started work to do a couple of things. One, we have a Mental Health Act that goes back to 1930. And so we're in the process of now doing consultation to revise that act and to come up with a new draft. When we left government the last time, we actually had done a draft, so we're using that as the basis to initiate some consultation to be able to now bring to the Parliament, maybe shortly after the budget, a new bill to deal with mental health. In addition to that, we are looking at developing a new mental health strategy, and we are going to revise the National Suicide Prevention Plan as well. So there are a number of things in train for mental health, but I agree with you completely. It's an area that we have been weak in. We have been very weak in, and we have to work to maybe strengthen that and to recruit more people to be able to offer more services in this area.
Okay, coming to that, it has been reported time and time again that there are shortages of doctors, nurses, and other medical professionals in Guyana. How do you intend to solve this problem? Do you have plans to recruit medical expertise from overseas, seeing that Guyana don't have the so-called medical experts needed?
I think we can approach it in different levels. So, for example, I wouldn't say we have a shortage of doctors. When I first came back to Guyana in 1990, probably had about 250 doctors that were working in Guyana at the time, and that's both in public and private sector. We now have close to 2,000 doctors in the system, and that's just the public healthcare system. So we do have a lot more doctors, and we have to work to make sure that these doctors are equitably distributed to the different regions. Because if you have 2,000 doctors and most of them are in region 4 and maybe region 3 and 5 and 6 and 2 or 10, then some of the other areas would remain underserved. And so we have to make sure that the doctors are properly distributed and that we are covering all the regions. We also have to look at some of the specialist services, because indeed there are gaps in terms of the specialized services that we offer, and we don't have those specialists in Guyana. So in those areas, in the short term, we might have to recruit those skills, but in the medium term, we have to train people in those areas. Some of the doctors that are in the system probably indicate that they want to specialize in those areas, to find scholarships to them so that they can be trained in those areas and come back and work with us in those areas. So for example, one area of need, I would say, is in the area of oncology. This is obviously an area where we need more local oncologists, both for adults and for children, and it's something that we have to work on to develop.
Okay, but when you talk about redistribution of doctors in the various hospitals and so forth, I understand that's a good plan. I'm from the quarantine, but if you have an accident or you get ill, 7:30, 8 o'clock at night, and you go to Skeldon Hospital, there are no doctors. You go to Port Brun, there are no doctors. There comes to New Amsterdam, there's one. And you got to wait hours for him to see you. By that time, you're dead.
No, well, it's we're changing that because Port Morant, we are going to do some major works in this particular budget. As you would recall, we actually had done an ophthalmology center at Port Morant. I visited there a couple months ago, and it's really in a mess. All the operating theaters and so are down, microscopes and so not working. So I think we put in this year's budget about $99 million just to refurbish some of the equipment. And just about a week ago, we were able to do 15 cataract surgeries with a team from the Georgetown Hospital. So we are going to restore back services, both by providing equipment and to make sure that we have the right complement of doctors to be able to do that. In Skeldon, for example, and I'm happy that you addressed that, Because when I visited Skeldon, there's a room earmarked, but there's no equipment. There's nothing in there. So even if somebody got an accident and you need to do a minor surgery, nothing can be done. And so again, we have budgeted money in this year's budget to outfit a theater there, to put in all the equipment. And Skeldon, if I recall, they have about 6 or 7 doctors that are working there now. Port Morant has probably about 7 or 8 doctors. New Amsterdam has in excess of 30 or more doctors. And this includes consultants. We have made a decision about 3 weeks ago that New Amsterdam now is going to become a teaching hospital, because we have enough consultants there where we can send interns to rotate in New Amsterdam Hospital, and where these consultants and senior registrars and so would be able to teach them. So we would be sending about 20 or 25 interns to rotate at the New Amsterdam Hospital. So we have more medical staff there. What we have to do is manage them better to make sure that they're there. If they're designated to be there in the nights, that they must be there in the nights. And that's something that we have to work on to manage.
Okay, let me just jump in here one before my colleague gets in. Cleanliness. Dr. Anthony, I've visited a number of hospitals in Guyana, and you go to the toilets, either some are blocked, sink overflowing, it's filled up, and you can't use the toilets. In the hospital wards of itself, some of them don't have no garbage cans, garbage on the floor. I've seen it with my own eyes at Georgetown Public Hospital, at New Amsterdam Hospital. And there are no bed sheets. I've seen patients lying on a mattress, no bed sheets, no pillows. Why is this happening in Guyana in this modern time?
Well, I don't know about the bed sheets, but certainly that shouldn't be, because we do make adequate provision to cover things like bed sheets and so. And as you would know, New Amsterdam should have its own laundry, and they should take care of all the washing and so forth to make sure that there isn't a shortage. Georgetown Hospital has its own laundry service, so that shouldn't be a problem. In terms of waste management, that's something that we have to keep looking at and reinforcing. I know there have been problems from time to time where people would come in to the facilities and steal things like the toilet bowl and so forth. And to prevent that, they have been trying to seal them off so that people don't take them away. I hope that we can create a different attitude, because if people are going to break up things like that, then it creates a problem. But yes, I agree with you that there are some facilities in which we can do far better in terms of its sanitation, and that's something that we have to keep working on. But this also has to come back to how people utilize these facilities. But definitely, I think we are doing much better at Georgetown Hospital, New Amsterdam, and some of the major hospitals. We might find that more at some of the other facilities, but Georgetown Hospital, I don't think we have so much of that type of problem now.
Over to you, Charles.
And I think, Dr. Anthony, is the quality of the workmanship for these facilities also contribute to that thing what Dr. Rose talked about, with these plugging up the toilets not working, water not coming, and sink blocking. A lot of the bad workmanship from the contractors contributes significantly to that. But I want to come back to COVID for a minute. For the testing, does the government carry the cost of testing for all Guyanese?
Yes, we are taking the costs. If you do a test with us, it's completely free. A PCR test, the average cost for that is probably about $20,000. In the private sector, it's about, some people charge maybe about $25,000. So when you do 350 tests per day, you can work out the maths there.
Yeah.
Antigen test is probably about $6,000 Guyana. And the gene export, I think, is probably about $10,000 to $15,000.
So if a person goes to the public institution, it's free, and the government carries that, but if they go to the private hospital, who carries that?
They have to pay for it.
There's no reimbursement from the government for that.
No, we are not reimbursing because you have an option to come to us.
But it was a waiting time with the public health sector.
I think we're doing fairly well. In Region 4, we have testing sites at the Georgetown Hospital. We have one at Paradise. We have at the Ocean View Hospital. We can do testing there as well. We have another place that we just opened in La Penitence. That's another site in Georgetown. And we have a site on the East Bank at Herstelling. So Georgetown, there are fairly a number of places. If people want to get a test, they can come to any one of these. Plus, we have given the antigen kits to a lot of our health centers so that they're capable of doing the antigen tests at some of these health centers. And in the interior, again, we have given out these kits quite widely.
Okay. I know, Minister, the Caribbean, Barbados was very good to us to give us some of their vaccines that they receive, and that was magnanimous of them. What is our current strategy to secure additional vaccine to ensure all citizens, especially our most vulnerable, receive the vaccine?
Yeah, so in terms of sourcing vaccines, we've been working on a number of fronts. So we have been working through COVAX. COVAX is a global facility that was established by the World Health Organization, CEPI, and Gavi. And so we have been part of COVAX, and they have a subset of countries called COVAX AMC, where for those countries, they're going to give us the vaccines free. They have told us they're going to give us vaccines for 20% of our population, and we are expecting at least 100,800 doses, either by the end of this month or sometime early next month. And these are going to be mainly from the AstraZeneca vaccine, because as you know, WHO has just recently approved those vaccines. We are also working with a number of bilaterals, and the Chinese are going to donate to us 20,000 Sinopharm vaccines. And again, those should be coming in by the end of the month. We also have been talking directly to a number of the companies who do manufacturing of these vaccines. And we are still in negotiation with those companies, and hopefully we can get a delivery schedule from them, because for those vaccines we are buying them. And our intention is that we would like to have a population so that we can reach herd immunity by the end of the year. And so that's the strategy that we are working on.
That's a good target. But Minister, there are some reports of the Chinese vaccine is not the best, and I was wondering why. I don't know. Well, let me put it this way: will the president and the minister of government take the Chinese vaccine?
Well, let's take the vaccines in order. So the AstraZeneca vaccine that was just approved by the WHO has an efficacy of 63%. The Chinese vaccine from Sinopharm has an efficacy of 79.4%. The Russian vaccine, Sputnik 5, which is one of the more effective vaccines, has an efficacy of 91.4%. AstraZeneca, the Moderna and the Pfizer, they're at 94 and 95%. So the vaccines that are currently becoming available have been proven to be very efficacious. And most of them right now are on the list awaiting WHO's approval. So WHO has a mechanism called emergency use authorization, or emergency use listing. And all of these vaccines, the Sinopharm one is awaiting WHO's approval. The Russian vaccine is awaiting WHO approval. And by the way, you know, you have in the US a vaccine that is being manufactured by Johnson & Johnson.
Yeah.
Right, and that is going to be given emergency use authorization maybe very soon. But that vaccine, the platform that is using is an adenovirus 26. And that's similar to the Russian vaccine first dose. In the case of Johnson & Johnson, that's a single dose. And it's a similar vaccine to the Russian vaccine. So, you know, what we have is a global pandemic.
Yeah.
And in fact, many countries were trying to get Pfizer and Moderna. They can't access it.
And they can't afford it too.
It just isn't enough.
Yeah.
And
Minister,
even if they can afford it, the production is not there.
That's true.
Right?
But Minister, there was a report that the Chinese vaccine have an efficacy of 50%, but you're saying it's more than that. But I guess that was a report that was in.
This vaccine is 79.4. The Chinese have about 8 different types of vaccine, and there's one that is called Sinovac. And in China and in some other places where it was used, they have recorded higher efficacy. But in Brazil, they found that the efficacy was about 50.1. That's
something
not
like
a vaccine that we are getting the one manufactured by Sinopharm.
Okay, Minister, you talk about the government will have to buy some of the vaccines. Some is given, and some will have to be purchased. Is there any discussion about a public-private partnership and the private companies who contribute to the vaccine maybe get a tax break sometime over a period of time? I don't know what Dr. Ashish Singh can maybe come up with so that they can also get a benefit from it.
The president has made it clear to me that in terms of resources, this is our priority. And if we have to buy the vaccines to make sure that our population is safe, then let's go ahead and get that done. So I'm working with that mandate from the president. And so we are trying to make sure that we can get enough vaccines to be able to immunize our adult population. So that's what we're working on.
So you're telling us
welcome any help from the private sector.
Yeah, but what you're telling us to the minister is that hopefully by the end of this year, Guyanese will have a herd immunity, hopefully, so that the virus will hopefully be mostly be gone. Is that what you're telling us?
We are working on that, but we have here virus mutates.
Yeah.
And so right now there are 3 mutations in circulation. You have the B117, which was first discovered in the UK. You have another variant that was discovered in South Africa, and one that was discovered next door to us in Brazil, the P1 and P2. Now, there are various things that can happen there, and one of apart from the increase in transmissibility, it also, in some of the studies, it's showing that the vaccines might not be as effective against these variants. And so it's a race against time. So we really need to start immunizing our population and do so quickly before the virus mutates. Yeah. And even with some of the major companies like Pfizer and Moderna, they are also doing some of these tests and trying to check their vaccines against these variants. And also, if it's possible, to start coming up with new types of vaccines that can be more effective against the variants. So it is in our interest to try to do this as quickly as possible so that we avoid having to deal with mutant strains that might not be as vulnerable to the vaccine as we hope them to be. And also, apart from that, there is some people, and because of misinformation or other things, might be hesitating to take the vaccines. And so that's something that we have to run a strong education program to be able to educate people about vaccines, protect people, and so forth. Guyana, by the way, has had a very strong tradition in terms of vaccination. And right now, we do about 18 different antigens for children. And we have been able to achieve between 95 and 98% coverage when we do immunization for children. So we have had a strong track record in administering vaccines, especially to children. And hopefully we can get adults to commit to the same thing. So getting to that herd immunity would really depend on people coming on board, understanding, taking the vaccine so that we can all be protected.
Definitely. And if you saw the minister, out of India, there seems to be a nasal spray vaccine. I think they're in the testing stage now. And that seems to have been working very well in the testing process.
Yeah, they have a couple vaccines that are like that. So I don't know the specific one from India, but I know the Cubans have been also working on one where you can actually spray it in your nose. And this technology is not new. They have done so for other types of vaccines. So for people who don't like to get an injection, this works well for them.
Minister, let's get back quickly to the health problem, the mental health problem in Guyana. I know recently we've been saying most of the time that men really kill the women folks. In New Amsterdam last week, it was the reverse. A woman killed her husband. But have you considered, we had Minister Passat on this program, and her ministry is also working with you, I believe, in the communities. Do you see a collaboration? Because this is a healthcare problem started with the community, and the people who know best are those who live in the community. Are you looking to maybe get involved, the religious groups, the civic leaders, whoever might be responsible in the community to help you to solve this problem of mental health? We lost Minister Devin. Devin?
Minister Anthony, hearing us?
Just give him 1 second, Charles.
Okay.
Yeah, I can hear you.
You heard the question?
You're here?
Yeah, we're hearing you now.
So what I'm saying is that there room for improvement in how ministries can collaborate. And certainly we need to do more programs in terms of anger management. We need to get the community involved. We need to train community leaders, religious leaders, to be able to use their influence in terms of bringing focus on how to manage with some of these problems. This is not new to the health sector. We did this when we were confronted with HIV. I'm sure you probably would recall some of that work that was done during that period, because there was a lot of stereotyping that used to happen with HIV. And one of the things that we were able to do was to work directly with pandits so that we give them the right information. And so when they're reaching out to their various audiences, they would be able to explain some of these concepts to the religious community, and therefore help to bring the change in the attitudes of people in those communities. I think a similar strategy can be employed with a number of other things, including domestic violence, because this is something that we can prevent, and we need to get people to understand this. And of course, some of the drivers of domestic violence. So when men go and they drink and so forth, and they get drunk, and the abusive behavior and so forth. So all of that, we have to look at the abuse of drugs, abuse of alcohol, and how do we work on strategies to reduce these things. One of the new programs that we would introduce this ministry is a program broadly to deal with chronic non-communicable diseases, but a component of it would have to do with some of the reducing some of the risk factors, such as alcohol and tobacco and so forth. And this is a program called HEARTS, and we're doing it in collaboration with the Pan American Health Organization.
Okay, Minister, before I ask Dr. Rose, one question was asked by one of our viewers is, what is the protocol for folks who are vaccinated? Is there a protocol?
Well, the current vaccine, I don't know if you mean by the protocol how you get a vaccine or what.
I guess the process, yeah. What is the requirement? I mean, who gets
Right.
it?
So when you come in to get the vaccine, we have a team that is comprised of about 5 persons pertaining to that specific vaccine, and they would explain to you what are the vaccine about, how it's made, where it's manufactured, some of the side effects, and so forth, and who is eligible for the vaccine. So once you go through that process, then you come to the second person who would do an interview with you to see whether or not you're eligible for the vaccine. And that interview is done because we want to ensure that, as you would know, some of these vaccines have not been tested in pregnant women or lactating women. And therefore, while the WHO has not said anything against that out of an abundance of precaution, we're not giving it to this population, right? So that type of screening is done, and once you meet the eligibility criteria, then move to the third stage, where the nurse would talk to you once again, tell you about the side effects and so forth, administer the vaccine, after which we put you to sit down for about 15 to 20 minutes where you're still under medical observation, because we want to ensure that if you have an adverse event, that we are able to pick it up. Normally it would occur within this 15 to 20 minutes period. Mm-hmm. And if there's such an event, that we can give you the kind of medical assistance that you need immediately. So that's the process. After your first dose, as in the case with the AstraZeneca vaccine, you would be required to come back within 3 months to get the second dose. And what the expert group that the longer you, if you come at 4 weeks, then the first dose is not going to be as effective. But if you come at 12 weeks for your second dose, then the booster dose would have a greater effect. And so we are following that advice, where the interval between doses are longer and the efficacy should be higher. So in the case of the AstraZeneca vaccine, that efficacy should be more than the 63% that the clinical trials would have given. So that's basically what we are working with so far, because the AstraZeneca one is the vaccine that we currently have in Guyana.
Dr. Rose?
Yes, Minister Anthony. There's a young Calypsonian woman by the name of Tashina. She sang a song titled, Mama, I Don't Want to Be Born. In that song, she says, if you have a gum boil and you go to the public hospital, you will go 6 feet in the soil. This means with a gum boil, you go there, you'll die. That's how much confidence and trust the public has in the public hospitals. Now, why are there always a shortage of medication at the public hospitals?
That's a good question. But coming back first to the Calypsonian, I remember that Calypso. Okay. And I think it also has to do with some of the perception that people might have of the Georgetown Public Hospital. But you know, the Georgetown Public Hospital right now can do some of the most sophisticated surgeries, because we are doing things like putting in stents into people. We are doing some of the cardiac surgery, open cardiac surgery, bypasses, and so forth. So we have been working to improve the services that we are providing. So yeah, we have been working, but that perception still lingers. And we have to do more to improve that image, and maybe some outreaches by the hospital to get people to understand some of the other good work that the hospital has been doing. This year, for example, we are restarting back pediatric cardiac surgery. That was a program that we had, when we were back in office some time ago, and we are restarting that program. So, yes, we can do there. But things you don't pay attention to it is a problem at the hospital, and we have to. And we have been working very hard to try to address that problem. I'm hoping that in the near future we wouldn't have those challenges, but as it is right now, we still do have shortages, and we are working in various ways of how to correct that.
Here is one of the problems. You're talking about the hospital is being very sophisticated and so forth, and I have no reason to doubt you. And I'm not here to criticize the professionals at the hospitals, public or private. But Minister Anthony, if ministers and senior government officials who have constantly been telling the Guyanese people that the public hospital or the public hospitals are equipped to treat them, but if they sneeze too hard, they end up in the States or Canada. How will those people have trust in the hospital or confidence in that hospital when the senior officials who are telling them that the hospital is good, they must go there, but when they get sick and not really any sickness, if they sneeze too hard or have a headache for 2 days, they're in a plane to New York, Toronto, or someplace. How do you justify telling the people that the hospital is good when you, as senior ministers, you all run out of the country for treatment?
Well, I can assure you I haven't run out nowhere.
Well, not you personally, but others.
But let me let you in on a secret. And the secret is that the ICU care at the Georgetown Hospital is better than every other hospital in Guyana. Right?
The private hospitals
so
do?
if you have better than the private hospitals.
Okay.
So if you have a very serious condition, right, and you require that type of care, the best place for you is at the Georgetown Hospital, because they have the equipment, they have the expertise, and they have the people to be able to manage these conditions. I don't think a lot of people realize that. Even right now, as we are treating with COVID, none of the private hospital accepts COVID-19 patients, right? Once you get sick, you can be, you can have all the resources that you want, but if you get COVID, the private hospital is not taking you. So we are seeing all the complicated COVID patients at our ICU, and we have been managing them, and we have brought in all the top types of ventilators, the monitors, and everything else to be able to do so. So again, I'm sure there will be people who have, we have to work to make sure that people can build that confidence in what we do. But I think we're going to get there slowly.
And before Dr. Rowe, before you come on, I think being a former employee at Georgetown Hospital myself, like Dr. Anthony is, Georgetown Hospital has come a long way. And they really, and as Minister said, the quality of service, sometimes things go wrong, yes, but I think you want great care, Georgetown Hospital is there. The other thing, Dr. Rose, I think Ms. Butler Lawrence answered that question about ministers not going to the hospital because of confidentiality as well. If the Guyanese know, oh, Minister Anthony is here, something happened to him, guess what? They will tell their friend and their friend and their friend, and next thing, hey, Dr. Anthony got a big heart problem or something like that. So those things also might contribute. I'm not saying it's it's the real reason, but those might contribute for the ministers going overseas for treatment. rather than going to the hospital. But that's my take, and I think Ms. Lawrence did address that issue.
Minister Anthony, since I'm a little boy, and I left Guyana at a very young age, growing up, if you go to the hospital, you have to wait in line for hours, sometimes 6, 8 hours. Today is the same thing. And you're telling me they have more doctors today, but you go to the hospital and say only one doctor we have on staff. And the line is there, people sit down there passing out in the waiting room or something. They can't see a doctor. Sometimes you spend almost a day at the hospital, especially Georgetown Hospital, and still can't see a doctor. How do you intend to remedy that situation?
That's a problem that we do have. And they're fixing that. For example, I actually have first-hand experience because I used to work at the accident and emergency at the Georgetown Hospital many, many years ago. And in those times, we probably used to see like 250 patients in a 24-hour cycle, right? One of the things that you would notice, because there are certain periods, so like early morning, we'll have an influx of patients coming in between maybe 5 to 7, 8, and that's because just before people get off to work, they drop in because they got a cold to see the doctor. And then in the evenings, after say 4 o'clock, up to about 10 o'clock in the night, you will see another influx of people. And sometimes a lot of these cases come to the emergency, but really they're not emergency. So one way of dealing with the problems that people have that are cluttering up the emergency is to create another area not too far away from the emergency where these cases can be triaged and sent to so that they can get the case without interfering with the flow. Because people would come to emergency with serious problem and don't get addressed. So there's some of the things that we have to put back in place. Right now, all of this has become even more complicated because of COVID. So when you come in, to make sure that you don't have COVID before you continue. Then have COVID, then they would shunt you into a different way of managing you and so forth. So that has complicated how we manage patients. And right now there is some amount of delay. But we are going to work to fix that. And the same thing with waiting times, because whether it's at an outpatient clinic, some of this we can solve with appointments. Waiting time for surgery. Right now we have a backlog because for the last year, since March, we haven't been doing planned surgeries. So now we are trying to, now that we have restarted planned surgeries, we are trying to clear up some of that backlog, and hopefully we can then take on the newer cases and so forth. So there's a lot of work to be done. And while we have resumed surgery at the Georgetown Hospital, I'm now trying to restart this process in the other regional hospitals as well. So, it's going to be a challenge, but we'll get there.
Mr. Anthony, I know you're in the hot seat, but you know why? You have to be in the hot seat because the nation's health on your shoulders. Here's the question.
Sure.
The quarantine has Skeldon Hospital, Blackbush Shaza Hospital, Port Morant, New Amsterdam, and they have one in West Coast Barbies, Fort Wellington. But only one hospital of the quarantine in that region 5 and 6 has an X-ray machine. That's New Amsterdam. And when patients get to New Amsterdam, the X-ray machine is not working. Plus, just 2 days ago, I got a relative who went to the Georgetown Hospital with a heavy tummy pain. And they said they did an X-ray. They said that she has a cyst. But they can't tell the size. She has to go to a private hospital to get an accurate measurement of the size of the cyst. So she has to go and spend $7,000 to get that done. Why is this still happening in Guyana?
Well, it shouldn't be happening because apart from us having X-rays at the Georgetown Hospital, if they're looking for assists. We do have a number of ultrasound machines, and we have quite a few at the Georgetown Hospital.
But they were not working when she went there. They were not working.
I can tell you they are working because I was there less than a month ago. I actually took time to walk through all these departments and see what they had and so forth. Plus, they have a CT scan at the hospital.
So why they send it to a private hospital until they can't tell the size?
That should be because they do have I know they had challenges with the X-ray machine, and we are working to fix that. Just last week, I gave them a new portable machine, a brand new portable machine. And the machines that they are currently using, which they constantly repair, we need to replace that machine because that machine is more than 12 years old. It's probably about 15 years old or something. So it's constantly breaking down. But in the interim, just last week, I gave them a brand new portable machine that can be used at the emergency at Georgetown Public Hospital. In terms of Barbies, we do have an X-ray at Skeldon. So we have an X-ray up there. I can't remember if we do have one at Port Morant. But definitely we have an X-ray machine at New Amsterdam, and also we have we have installed the CT scan at New Amsterdam, and that is working, right? So this CT scan was only installed probably about 2 months ago or so, but it's working. Right, and we have been working with a group out of the US called Radiad, and they have been giving us a lot of technical support. And in fact, they have been working with our radiologists to train them to be able to do interpretation for CT scans and ultrasound and so forth, and echocardiographs and things like that. And those that we can't interpret here, we actually send them up to the cloud, and they're downloaded in the US, and we get a team in the US that would help us with the interpretation.
Dr. Andy, one thing I'll let you into a secret here. I don't know if you know this. If someone dies of the quarantine in a car accident or whatever it is, and has to have a post-mortem, that body has to come to Georgetown, because Barbies don't have, what do you call the doctors say that do post-mortem? What's the name of the
pathologist?
Yes, they don't have one. But the police or the ambulance will bring the body to Georgetown, and these people are not going to pay for it to go back up the quarantine for burial. Why is this that you're going to travel?
We got one now. We have a pathologist there now. We have Dr. Mohan there.
Yeah, but he does refer the bodies to Georgetown because he does private practice at the same time. So these are things that you don't know.
Dr. Bridge Mohan is now employed by the state to be able to do these autopsies.
Okay, but that's not what the people are experiencing, though.
I know this because this was one of the problems that was brought to our attention, and between myself and Minister, this was one of the early things that we worked on. So Dr. Bridge Mohan was not in the service of the state. We were able to then recruit him and bring him back.
Dr. Audrey, I get a quick question from a nurse at New Amsterdam Hospital, and she asked me not to let you know her name. Do you have technicians at the hospital to fix an X-ray machine? She is telling me that for the last 3 months, the X-ray machine in New Amsterdam is done.
To fix what?
X-ray machines. She said months and months they don't work and nobody comes to fix them. She just sent me that text there. At the New Amsterdam Hospital, she just sent me the text. Said she's a nurse there. She said the machine is there,
I can check
but it don't work.
That's not a report that I have, but I can check on that. So generally, we do
Okay.
have, I know for sure that you do have a biomedical technician at New Amsterdam situated in the hospital. That's the human technician that we have there. In addition to that, if there's any specific one of the biomedical technicians from one of the local companies to come in and address the issue.
Okay. I know, Doctor. I'm glad you mentioned Dr. Bridgman, because when I was at Georgetown Hospital, Dr. Bridgman was working with us as a pathologist then. And then he
Yeah.
said he's back now in the system. Okay, great. Minister Vishnu Mahadev from New York here, he said that information was sent weeks ago to Guyana about the New York group, the diaspora group, bringing 50,000 AstraZeneca vaccine. And he said there was no response from your ministry. He also said the diaspora can bring in 50,000 within 2 weeks and 100,000 lots thereafter. Are you aware of that, request to supply Guyana with those vaccines?
I don't know. I think Vishnu was trying to make contact with me. But we have been, in terms of AstraZeneca and any vaccines, our preference is to deal with the companies or agencies that has a direct relationship with these companies. We have had, I don't know, maybe about 10 or 15 different private people that approached the ministry claiming that they can have access to these vaccines. And when we start going through the pathway of how they can access the vaccine, it's a very complex process. And since we are able to source it directly from the source, whether from the Serum Institute or through COVAX or one of these agencies, we'll prefer that type of arrangements rather than going through several layers of persons, and then we are not certain what we're getting at the end.
Okay, Minister, before we go to break, let's get into politics a little. I know you ran for president as a one presidential candidate for president. Is there a Frank Anthony faction in the PPP? Is there a finale faction, or everything has come back to normal again?
There's one team, and that is the PPC. And
Okay.
we're so busy trying to fix Guyana that, we have to keep it that way. We have a manifesto that we all worked on. And now that we have envisaged what we wanted and given us that mandate, we now have to deliver on that. And that's what we're working on.
Okay, great. That's a great answer. And I like that answer. Minister, come back to Ocean View Hotel. You know, the prior administration spent over $1 billion in that hotel. And then there was claim by the owner, Mr. Rambaran, I believe, that the government owes him a lot of money. Can you give us an update on what's going on there and with that fiasco?
A lot of money was spent on the property. And for us to get it ready, we also had to spend resources so that we can bring it to the state where we can have patients in there. Because certainly when we took it over, it was far from a hospital. So we had to do back a lot of work, plumbing and electricity and making sure that it's ready to be inhabited. And then, of course, we had to buy equipment, beds and furniture and other things. Setting up X-rays at the Ocean View facility, putting in ICU, putting in the gas and all that. So a lot of work had to go in there. In terms of the legal case, I think the Attorney General would be the best person to be able to address those matters.
Okay.
And I'm sure that Mr. Rambaran would have been engaging the Attorney General.
Okay. Minister, you have two former ministers as your advisor, Dr. Ramsamy and Dr. Ramsaran. How is the relationship between you and these two gentlemen?
We have a very good relationship, and they bring a wealth of experience. So I had worked with Dr. Ramsamy in the earlier days, and during that period, I was the head of the Health Sector Development Unit when Dr. Ramsamy was the Minister of Health. So we have a long working relationship in health, and I think the experience that they bring certainly can enhance what I'm doing in the ministry. And of course, with Dr. Ram Suran, I know him from a long time, and our relationship goes back to when we studied together, when we studied medicine together. So that's a relationship. So again, I think with both of them, they bring their different perspectives and strengths. And as a team, I think we want to move this sector quickly along. There are some programs that we want to rebuild, and there are new programs that we want to introduce, and that's what we're working on.
Okay, Minister, when we come back, we'll take a break, a short break. When we come back, we'll continue discussion because there's so many more questions to ask you, and time is running out. But let's see when we come back what we can get accomplished.
All from One Supplier is pleased to announce its online shipping for West Indian and American groceries. Order online at allfromonesupplier.com and with free shipping and deliveries to any part of the United States. Save time and energy to shop for all of your West Indian groceries from the safety of your home or office. We carry West Indian products like curry powders, meats and fish, dashing bush, pepper sauce, sodas, and your favorite snacks. All from One Supplier has it all. All from One Supplier fulfills and ships your order directly to you. So visit All from One Supplier today to start shopping, or call All from One Supplier at 718-551-3292 to handle all of your West Indian grocery needs. That's All from One Supplier, 718-551-3292. Free shipping, free deliveries, or curbside pickup from allfromonesupplier.com. Travelspan is now serving Guyana for over 26 years. They offer all airlines such as American, Eastern, Caribbean, and JetBlue. Guyana now has choices, so let Travelspan compare all airlines and offer you the best fare. And don't forget, Travelspan now has a shop, ship, and cargo division. So if you cannot travel, then shop and ship your items to Travelspan. Travelspan clears your items with customs and also has your items ready for pickup at any one of our offices in Georgetown, Berbice, or West Coast Demerara. Call Travelspan in New York at 718-845-0437, Georgetown at 227-1701, or Berbice at 337-4287. In New York, 718-845-0437, Georgetown 227-1701, or Berbice 337-4287, and West Coast Demerara at 269-0140. Let Travelspan book your flights or ship your items. AllFromOneSupplier.com is promoting Gaisuku sugar as a way to support Guyana sugar industry. Purchase your Gaisuku sugar from allfromonesupplier.com along with your West Indian and American groceries. Purchasing Gaisuku sugar is a good fate gesture to help restore the sugar industry. Allfromonesupplier.com has free shipping and delivery, and we ship to all states and free deliveries in New York. Log on to allfromonesupplier.com or call 718-551-3292. That's allfromonesupplier.com or 718-551-3292.
Welcome back to our audience. We want to thank you for staying on, and thank you, Honorable Minister, for being so candid in your response to our questions. And there's so much question there to answer. Minister, the philosophy of institutions allow for introspection of its continuity and function, training and education, research and development alongside a strong quality assurance is pivotal to building strong health systems. Oftentimes, we find these components are lacking in our hospitals, clinics, and within the central ministry. How do you intend to improve these structural deficiencies in our health sector to improve better health care? Will there be postgraduate training, as you said, for oncologists, for instance, or different specialty, that they will get a scholarship to go and train and come back to Guyana to serve the community?
Yeah, training, we have to do a lot more in terms of training. So, for example, we do have three nursing schools in Guyana, one at New Amsterdam, one in Georgetown, and one in Linden. And our games that we run there, we have to upgrade them. We have to redo some of the curriculum and what we are training people to do. So that's one set of things that we have to look at. In terms of specifics with certain categories of health workers, whether they're medexies or pharmacy assistants or community health worker, all these programs, we have to upgrade them so that they are more purpose-built for the kinds of services that we want to offer. And that's something that we have started to do. But right now, many of the training programs have been interrupted because of COVID. And we're now trying to see what kind of hybrid systems that we can put in place to have some of these programs continue. So these are the existing. In terms of training of doctors, the University of Guyana has expanded its training intake. And I think now they're taking in about 50 students. And you have a number of private universities doing medicine training in Guyana, Texila being one of those, and there are some others. And again, the output from these institutions have been increasing. So this year, for example, I have 90 interns that want to come to rotate at the public hospitals. We were accustomed to handling, say, 50 at the Georgetown Hospital. Now we got to deal with 90. So we have to look at how we can.
You break up your minister.
We now have.
You're breaking up.
We now have about 10. Okay, you're hearing me now?
Yes.
Oh, so we now have about 10 postgrad programs, and where we train people in orthopedics and internal medicine, anesthesiology, people specialties. And these are joint programs that are run by the Ministry of Health, GPHC, and the University of Guyana. Last year, we were able to open the Yusuf Prasad Clinical Center, and that is now going to be the place where most of our postgrad training programs would be run from. So this year, we're going to be spending some resources in terms of equipping it, making sure that we have these simulation labs and so forth to be able to do that type of postgrad. We don't have the facilities to train people, and for those, as you rightly said, we have to look for scholarships. So in the area of oncology, that's one area that we're looking at. In terms of using radiotherapy, this is something that we are working with the International Atomic Energy Agency to be able to get some scholarships to train people. They have offered to give 5 scholarships, at least in this year, to be able to train persons in radiation medicine. So we'll be working with them to get
so
people trained this year.
You got some great plan there for training. But Minister, I was told, and if it's true, that the law in Guyana does not permit a nurse to instill IV in patient. It has to be done by the doctors.
I think for some category of nurses, they would be able to do that.
The law permits them to do it?
I think the registered nurses are able to do that, but I need to check. But I think there are some categories that are able to.
That they can do. Okay. Dr. Rose?
Yes, Minister.
Yeah.
Here is a big P for you, and I know this is not your problem, but it exists in Guyana long before you. Cuban doctors. A lot of them we reported don't speak the English language. And when a patient is at the mercy of someone who can't speak the language and has to have an interpreter to interpret what or to diagnose what went wrong, that patient is put at a disadvantage. Now, that's one part of the question. How you intend to remedy that? The other part of the question is this. How would you rate the public hospitals in Guyana vis-a-vis the big three in the Caribbean, Jamaica, Trinidad, and Barbados? You heard me, Minister?
So that's the one. Yeah.
Okay.
Let's start with the one dealing with Cuban doctors.
Right.
So about 2 years ago, I was part of a delegation with the Guyana Medical Council. We visited and discussed with them. And one of the requirements is stipulated that, and we have to work to make sure that they actually send these doctors that really understand English. When they arrive in Guyana, one of the requirements of the medical council is that they do a test that is arranged by the University of Guyana to check their competencies in English. And once they pass those tests, then the medical council will grant them the institutional registration. And that has been a process that we have employed. Now, we do get complaints from time to time regarding this question of communication between doctor and patient. And those are things that we do have to work on. But the medical council itself, so far has been satisfied that the doctors that come understand English. So I'm working with that. But if there's specific complaints, then we can address them because we have regular meetings with the Cuban Medical Brigade to address some of these challenges as it comes up. And in terms of performance and so forth, all of these things are regularly reviewed now with the Cuban Brigade. In terms of how we'll rank ourselves with external hospital, I am not sure because I am not acquainted with the hospital in Jamaica, nor the one in Barbados, or maybe the one at Mount Hope. So I'm not sure the types of services and the level of services. So it's going to be difficult for me to try to do a comparison. But we know that we still have a far way to go at National Hospital, the range of services that we want to offer. And certainly we are working on a plan to improve that. In fact, with the installation of the new board at the hospital that I've tasked them with is to come up with a short-term, medium-term, and a long-term plan of how we see the different services of the hospital improving. Some of those things that you touched on in terms of waiting time, turnaround time for diagnostic testing, and so forth. I asked them to address some of these things in that plan that they're developing. So we are cognizant that while we know that we have been improving, there's a lot of areas that we need to improve, and there's still a lot of scope for growth, and we want to get there.
Okay. What institutional change and structural changes you intend to make in the first 5 years of your tenure as the Minister of Health in order to provide proper, adequate, and satisfactory health care to the citizens of Guyana?
Well, there are a number of things that we are doing. So we have started working on a strategic plan for the ministry, and we have a draft that is ready, and that draft goes from 2021 to 2030. And it covers a number of areas, including how we would restructure the ministry to deliver the types of services that we ought to be providing. That's one. Two, if we are going to that we need, and how do we plan to get this type of human resource in terms of training, in terms of the kinds of qualifications and so that we need to be able to deliver this type of service. We have also looked at the healthcare or the legislation that we currently have in place. And as you can imagine, most of the legislation is really outdated. Myself and the Attorney General had a conversation. I actually sent him a list of legislation that we want to upgrade. There are more than 21 pieces of legislation. Some of it is upgrading existing ones. Others is writing new pieces of legislation. So that's going to be like a full-time job for somebody to help us to draft all these bills that is necessary, and then to take it into the Parliament to be able to pass that. Right now, for example, and we have been doing this for a while, where we do kidney transplants. But Guyana doesn't have a law to allow for kidney transplants. We have been transfusing blood for quite some time, but our law, there's no law that allows for transfusion. Basic things, I mean, like transfusion. So we have to put these things in place. And so another thrust is to make sure that those kinds of legislation are put in place, and that we have the legal framework to be able to do this. In terms of disease control, there's some low-hanging fruits that we are looking at. Well, not so low-hanging. There have been diseases that have been persisting in Guyana, but we think that we can achieve elimination of some of them. And one of them include the filaria. This is a program, this filaria has been with us for a long time. This second round of activities that we have, the mass drug administration that we are currently doing right now, would lead us, once we get 70% of our population taking the tablets, that we can be certified as being filaria free. So this is a program that is currently ongoing, and we are very confident that we will be able to achieve this. Another one of the diseases that we are working on to eliminate from Guyana is leishmaniasis. There are endemic areas in Guyana that where you can find leishmaniasis.
What was that? What was that? Was that
leishmaniasis?
What's that in local language?
Bushias.
Okay.
People might know it as bushias.
Okay.
So this is something that we are also working on to try to get elimination, and we are hopeful that we can do that maybe within 5, if not within 10 years, that we can eliminate this from Guyana. There's another disease called Chagas disease that we are confident that if we work at this very, diligently, that's another disease that we can eliminate. All of these form a portfolio of disease called the neglected diseases by the WHO. So a lot of emphasis have not been paid to them over the years, but they form a substantial burden of diseases in the country. And we can spend the resource. So we have set our sights on a number of these types of diseases, and we are going to work to be able to eliminate them. In terms of malaria, which has been around for quite a long time, we have a program where this year we will be rolling out bed nets to a lot of the communities that are affected by malaria. And these are bed nets that have been impregnated with insecticides. So when a mosquito lights on the bed net, the insecticide would kill the mosquito. So we have already bought about 150,000 bed nets, and we'll be distributing that shortly into the interior areas. So we are hoping that we can reduce the burden of malaria in these communities. In terms of HIV, we have some plans that we'll be rolling out over the next 5 years with HIV. We have just completed a strategic plan for the next 5 years for HIV. We have submitted that to the Global Fund for funding. So we have this new plan to be reducing prophylaxis, meaning that if you think you're at risk for HIV, that you can take prophylaxis and reduce your level of risk. Right now, only people who are in a discordant relationship would be able to get the medications for prophylaxis. We are changing that to allow anybody who feel that they're at risk, that we'll be able to give them these medications. We are also going to introduce self-testing for persons who want to know their status, and that's another program that we'll roll out later in the year. TB is another area that we have put some focus on, and we've had some cases of multiple drug-resistant TB in Guyana. And we're trying to make sure that all the TB patients that we have can receive treatment. We have a network of what is called DOTS workers, because they come to you, give you your medicines, and observe that you take them. So that is another program that we are rolling out very effectively, and we want to reduce, again, the burden of TB.
And Minister, where does ringworm fall into that category?
From the area of diseases. So things like diabetes, hypertension, cardiovascular diseases, cancers, and so forth. And in this year's budget, we have actually created a new program to address chronic non-communicable diseases. And so a lot more emphasis would be placed on these things.
I was talking about ringworm, Minister. Ringworm is part of the problem in Guyana too?
You don't see so many cases now, but they're probably there.
Okay.
That's generally a fungal infection.
Okay.
That's our 90 minutes, Minister.
Minister,
that's our 90 minutes.
Minister, what I've learned from you tonight is that when we had the president, he did say that what he would like to see was the quality of life in Guyanese improve. And what you have outlined tonight, I think, is in the same direction that the president has indicated. And if Guyanese can have good quality health care and we have a healthy society, I think the quality of life in Guyana will definitely be much better than it is today. So, Minister, you have a great task. I see your shoulder is very broad. I think you can take it on. You do have two competent advisors, Dr. Ramsamy and Dr. Ramsran, that will working with you, and of course your entire team. And we want to wish you, Minister, all the best. I want to thank you so much for joining us tonight. We did not get a touch on the budget, but I hope that maybe you'll come out sometime in the future. We can talk about the implementation of the budget in your ministry. As you said, you got 53, or you're getting 53 billion. In the current budget, I believe.
5.
Is that current and capital or just current?
Current and capital, 53.5.
Okay. So there's a lot to talk about the budget implementation. So, Minister, in closing, do you want to say anything to us tonight?
We can probably talk about some of the specific programs maybe after the budget.
Okay, wonderful.
Because some of the areas that we want to do, and I think people need to know more about what we are trying to do. I think COVID has dominated the conversation as it relates to the Ministry of Health, but we have hit some of the other areas. And as you can see, we've put a number of initiatives in place to be able to handle those areas as well. So, like currently, we are rolling out that filaria program, the elimination of filaria, and we have a number of other things that we're working on in chronic non-communicable diseases. So we feel confident, we have a strong team, and that we'll be able to accomplish quite a lot in the ministry, and we have already started to develop some of the plans with very specific objectives in mind to be able to achieve that in the next years.
Minister, you have a dog there next to you that is giving us trouble?
Yes, well, this is Guyana,
Dr. Rose, anything before we close?
No, Minister Anthony, I really want to thank you, but don't go off. I said I want to talk to you off the air. But you did a fantastic job. You answered the questions, and I was I was actually, to tell you the truth, a bit tougher on you because I know you and I know you're doing a very good job, but still, there's some underlying things that you're not aware of. And I'm not blaming you for that. It's just that the reports are not reaching you. So somewhere down the road, you'll have to improve that angle to get reports, what's happening on the ground in each hospital, so that you can say for sure, well, this is working, that's not working, fix it.
Sure. I agree.
Okay.
All right, Minister. Again, we want to thank you for being with us, Dr. Rose, to our audience, to Noir Singh and to Devin, to all of you out there, good night. Next week, we expect to have this Chief Executive Officer for Gaisuko, Mr. Sesnarayan Singh. So please join us next week for that important interview as well. To Minister, thank you again so much for being with us and spending 90 minutes, as Dr. Rose said, with us tonight. And thank you again.
Well, thank you